and welcome to the Hans Brinker Leadership Series, Extraordinary Leaders in Extraordinary Times by Adi Partners. I am Sanjay Viswanathan.
COVID-19, the pandemic of this millennium, has actually changed our daily lives irrevocably. People fighting this pandemic at the coalface in healthcare, travel, supply chain, government, non-profit, and media deserve recognition. I am Hiral Desai. Sanjay, we've had some amazingly insightful discussions in the Hans Brinker Leadership Series, haven't we? And the most amazing bit of it is an overwhelming response from our viewers. So firstly, I would like to thank all the viewers for watching us and following us.
Absolutely, Hiral. In fact, as we continue identifying some truly extraordinary leaders in these extraordinary times that we live in, and as we get them to share world-class practices in their battle against the coronavirus, we have a tremendous opportunity here to create a cohort of champions who can influence and energize this war against the COVID-19. So this series, as you and I have talked about many times, is really about providing everyday leaders that everyone around the world can identify with, to share the best practices and for us to appreciate their efforts in this long-standing battle against the coronavirus. And our journey here is going to take us around the globe, from India to the United Kingdom, to the Middle East, to Europe, to Americas, and then across the Pacific to the Far East and China, where it all started.
In fact, in our previous episodes, we've spoken to doctors, ENA professionals, psychologists, and psychiatrists. Let us now move one step forward and see how another community, which is one of the most as well, the non-profits, how they are helping the world fight COVID-19. Let me introduce you to Akhila Sivadas, Managing Trustee and a founder member of the Center for Advocacy and Research, that is CFAR. We're delighted to have you in our program. Welcome to the show, Aquila.
Thank you. Thank you very much. Thank you, Hiral. And thank you, Sanjay.
It's a great pleasure, Aquila. And let me add my welcome to have an inspirational leader such as you, because we're looking at you as one of the 168 cohort of champions that we'll identify around the world. And eventually we'll have the Hans Brinker Prize at the end of it. So one of the things that we want to dive into with you to begin with is to talk a bit about CFAR, especially because the organization that you run has been in partnership with several community-led structures to provide COVID-19 relief across cities and states in India. In fact, what we understand is that you've been providing this similar services across 14 cities in 10 odd states. So what would be great is for us to understand from you, what is the sort of experience you had so far in this battle against the virus?
Okay, to set the context, CFAR is an organization which is about 22 years old. We set up in the late 90s, and it became very clear, the last 2 decades, it became very clear. And by 2006 and 2007, there was actually a fairly strong recognition that, urban poverty or urban squalor is as grim and as serious as rural poverty. In fact, it has some even bleaker shades to it. And it cannot be equated. It's not the same set of, shall we say, variables that work. In the urban context, it's about extremely, shall we say, undignified existence that the poor are subjected to. It's about dignity. It's about quality of life. It's not about money. Money can be made. You can sort of cobble up something for the day. But can you heal yourself from all the hurt and humiliation? Very difficult. So we heard this loud and clear very early. And we are one of the few not-for-profit that work in the urban sector. There's a lot of work being done in the rural areas. In fact, there is, and rightfully so, there is huge concern and anxiety about the rural poor. And there is a whole huge section of assetless poor, who have joined and swelled the ranks of, migrants. And now the more recent phenomena called the circular migrants, they keep moving from one place to another. It almost has the touch of, going back to a nomadic existence. You can actually see them. If you ever visit a railway station, you actually visit the milieus in which the poor live, you will see them. Every season when there is a breakdown, they're carrying headloads and moving from one part to another. This happens from rural to rural, urban to rural, rural to urban. There is no set route. So they keep swelling the ranks, and how precarious their existence is. And within it are women, within it are young girls, within it are people with disability, and you can go on with the list, the transgender, the leprosy affected, anything. I mean, you can just go on, right? Because, so we have been over the last 21 years, two things we have done. One, to increase their voice and agency. They're intelligent people, extremely skilled, very deft. The city will come to a halt if they are not there. We can be dispensed, they cannot be dispensed. Their contribution is enormous. So, and we have been able to, some of it has got resonated, some of it has got picked up. Many small, big steps have been taken. The COVID-19, it almost looks like we were getting ready for a crisis of this magnitude. I imply the community. They go through many crises. And this is, of course, something, in one word, just overwhelming.
So how is the role of CFAR in that context? And I'm so glad, Aquila, you set the context for our viewers to know about what CFAR does. So therefore, in having come through this journey over the last 20 years, how has the role of CFAR changed during COVID, and how do you think it will change in a post-COVID era?
I wouldn't use the word change so much as I would say put the spotlight on the poor. There's always a lot of tut-tutting. Yes, we must do something. We must think about them. Yes, we need to look downstream. All of that, shall we say, some lateral thinking was always there. It's not that, the poor were ever, not recognized or their concerns not recognized. But there's always a sense that we have to be ready to help them. There have to be protocols, there have to be guidelines, there have to be, different kinds of institutional strengthening, all of that. And notwithstanding, all that is important. But why don't we just, for a change, turn around and decide to listen to them rather than, recommend or suggest to them. And that's what we've been doing for the last, 15 years, not necessarily, shall we say, gaining the traction that we need to gain, not as us, but as people. I don't think we got that kind of traction, but we quietly prodded on and organized them very strongly from 2012. And we've helped them to step into every kind of, shall we say, void and vacuum, because there's huge vacuums. There is a poor, and there is a system, but how do you connect the two? And there are many levels at which you have to connect. So from 2012, we have prepared that whole structure of connecting to households that are living outside the city, connecting to households living in low-lying areas, forgotten areas, completely disconnected with the city, connecting them with communities they've never met, never seen, never, heard about them, living quietly, marking their days somewhere, hidden somewhere this thing of melee of the city. So a lot of that was done, and as soon as COVID set in, lo behold, who made it possible? You can get the money, you can get the food, you can get all your, web, what you're talking about and what you're doing with me right now. All of that connections you can get. But can you get to the people? Very tough. Who can get you to the people? Lockdown, social distancing, no public vehicle, no scope to move from one end of the city to the other. Who will do it?
Yes.
Lo, behold, we had a little above 3,000, shall we say, frontline community leaders taking on that mantle.
Wow.
And providing the first level of food relief. The hunger is unimaginable. Unimaginable. We always knew it. We've seen street children absolutely, in huge hunger pangs, and but it didn't confront any of us the way it has confronted us now. And there's no certainty. Even if you give one meal, even if you give one ration for a month, what about the next month? What about the month after? This is definitely nothing less than 6 to 10 months minimum, this distress, So where are we? How do we do it? And these people have organized themselves. Everything has been organized. The government also rallied, and everywhere the governments rallied. In the beginning, the police were a bit repressive, but even within their ranks, there are many well-meaning people and, humane people,
Yes.
and they also stretched out, and the others also stretched out. But you need this, not last mile. They're always referred to as last mile, as front line, as grassroots, as though, the rest, the superstructure is super. The base can stay base, but that's not true. The world is a little upside down. The base has become the superstructure.
Very well put, indeed.
Absolutely. In fact, it's phenomenal job that CFAR is also doing. Aquila, now that you've told us the number of people that are working on the front line as well, if you could just help us understand what is on-ground reality really looking like, especially if you have to talk about the families of these migrant community workers who probably must have not really reached their village yet. So there is anxiety, there is stress amongst the workers who are still going back to their villages and within their families as well. How are they actually coping with this pandemic?
So it's a very mixed scenario, Hiral. I mean, there is a huge distress. There is really huge distress. We've worked with urban poor communities. We saw some bits of this about 12 to 13 years ago, in 2006, 2007. We saw huge, levels of, frustration and anger. What in Hindi we refer to as akrosh. It's actually brings the punch, that word, like right out of the chest, you're sort of, that anger. But we have never seen this as we have seen today, what we call, shall we say, complete, shall we say, meltdown and acute distress, the kind of uncertainties, I mean, it's unimaginable. And I can tell you that in the midst of all this, we are talking to a lot of them. We are in contact with all of them. There are also the homeless. Don't forget, there's a huge section of homeless. In our journey, we have also discovered in a city like Delhi, there are about 900 households that are run by children. There are no adults. So, there are families and families that you and I cannot even imagine, in our ordinary consciousness and, interface or whatever. And there's huge levels of distress, a lot of uncertainty. And in the midst of all this is the woman. They are putting things together. They're not only leading the front line everywhere, they're not only extending their help and support to everyone. They're not only, reducing the anxiety of even the government officials. The entire implementation machinery is equally tense, equally worked up. They're also allaying their anxiety. They also have their set of anxieties. and, putting back, I would not so much, more than hope, they're putting back the currency that, we have always been talking about, and that is self-worth, self-belief. I cannot tell you how much that, helps, how much it's sort of, the ripple of it is so strong. And that's where we are getting in. We are trying our best everywhere. It's complete lack of unpreparedness, no sense of, how do we go about doing this? Any public health emergency requires a huge amount of planning. It requires mock trials. It requires readiness at every level, and none of that has happened. And the entire burden has now fallen on the poor. And all we are doing is keeping some things going. Even that, is not, at no level can we say that we are reaching every nook and corner, every distressed person. There are pregnant women, there are, cancer patients. There are, just last week, we had to rush an HIV positive person to the hospital with the support of our NGO friends. So there are huge layers and layers of crisis and all of this. So, we are in for a long healing. We have to move now from this quick, immediate relief to medium level rehabilitation. The government needs to put its best foot forward. It needs to, create what is called an emergency response. It has to trust people like us. Not for profit, cannot be called as and when needed. There has to be a professional give and take. Okay, so norms of, interactions, norms of, collaborations, partnerships have to change. And we have to sort of, shall we say, be mutually accountable. You cannot play big brother, big sister. You cannot play superstructure, and you cannot wave your technology magic wand. There is none. It's as good as if any other wand is available. So I think we need to give equal importance to everything, and plan medium term, and then maybe long term.
Absolutely, Aquila, point well taken. Very quickly, if you could just help us understand, are these communities benefiting at the grassroots level, with regards to the government relief that is coming in, or do you think something needs to be done? And if you could incorporate what they're doing for the transgender community.
Yeah, yes. No, there is something being done. There are community kitchens being run. Even in normal times, we needed these kitchens. There's a lot of hunger, especially among the urban poor. But now that, there's no other way, the community, and with this lockdown, so community kitchens are being run. Effort is being made. They've got huge stockpiling of food grains. You've seen the news item, the news reports. And, they actually need to be now taken away from there so that the fresh stocks can come in. And so attempts are being made everywhere now to distribute dry ration. We are also trying to get what is called the take-home ration, which is your supplementary nutrition for pregnant women and children between 3 and 6. We are trying to get that distributed like any other ration, a dry ration, with all the nutrients in it. So there is some bit of moving around, shall we say, on the chessboard, moving around the pawns or whatever, to see that, this gets structured to the relief package that is being given. Also, an attempt is being made to, rush 1,000 rupees as assistance. 1,000 rupees is a very small amount.
Correct.
It really doesn't take you far. But even for that, there is a clamor. And even for that, there are Aadhaar cards, and there are a whole lot of, barriers that need to be overcome. And they need to be given upfront on basis of self-declaration that I'm poor and I need it. Because the error of omission is much worse than the error of commission in such a situation. So we hope that that kind of wisdom prevails in the long run, and that no corners are cut. in providing relief. But in all this, I must add one line that the not-for-profit, the NGO sector, the entire, the community sort of, movement structures have stepped in a big way and, made a lot of the relief possible at every level. So I think formalizing the partnership now on even terms, not on, big and small, not on now and then, as and when, is the critical crying hour. And for transgenders, there are many, many problems. Right now, they have a problem of a bill being pushed and, formalized at a time when their guards, every bit of their defense guards are down. They cannot sit and now pontificate on a bill. They already have problems with the legislation. They would like to voice their problems, get a decent audience and hearing, and do it when things are in a doable or a doing state.
Yes.
But the more important is, both in terms of the work they do, whether they seek alms, which is one of the main source, whether they get actually bounties in different, ceremonies and rituals, all that has dried up. All the source of income has dried up.
Yes. Yes.
So now we are all rushing in, one, to get them some financial assistance. The central government has sanctioned some, the state governments have sanctioned some. All the relief, the dry rations to be rushed to them. And in the entire urban wage employment initiative that they're trying to roll up in some states, like the Manrega in the rural areas. Right now it has begun in Odisha. We are trying to sort of ensure that the transgenders get parked there. They're extremely good in painting. They have many skills. They have tremendous culinary skills. They can cook very well. They can paint very well. They're great entertainers, that, So they can be used in diverse ways, wall painting of all the COVID messaging, all that can be, given to them. And new avenues can be created. So all of that is on the radar right now.
Yes, that's a terrific initiative, Aquila. And that's, a community that I think in India for sure, but certainly when you look at pockets of the world, is one that is marginalized. And I think what you're doing here at CFAR is extremely laudable. One of the things that I want to switch to on the back of that, and again, if you can keep the context as bringing about an impact for the transgender community, as an example, how would a non-profit like CFAR make use of technology? And do you see technology as a key element of your strategy on the ground?
Yes, and more so in the times to come. When we are going to be, we need to use every possible technology from IVRS to the most sophisticated to reach the most remotest and the most, neglected and marginalized groups. So in terms of reach, at one level, you need the technology. But at another level, you need communities. Like, for instance, we have what are called help desk. Who are these people who are actually helping? They've been structured into help desk. The help desk has representation from transgender, construction workers, because each one has a different reality.
Right.
They have representation from denotified tribes, different, garment workers, all of that.
Yeah.
So, and then they work with their constituencies, which includes their factory worker, owner, all of that, the management, everybody. It's not just you and me, because, we are not in an island. So that entire universe, if you're a sanitation worker, then they create a WhatsApp group of everybody, including your sanitation inspector, so that everything gets zoomed in through that technology and everybody is face to face and the right knows what the left is doing. And if you don't, then it's your fault, not mine. So, a lot of that is proving to be a boon. But if you create what is called a primacy, and keep saying, and you keep sort of, supporting technology versus community or community versus technology, and you don't bring them together or orchestrate them together, you're going to benefit neither, and public service requires both. It's no brainer to say that. It requires both, and more so now. Where we have a problem is we are now doing online registrations. Everything that you do with the government has to be online now. They will not, as far as they're concerned, you are persona non grata till all your stuff gets stamped online. So your servers don't work. You have the luxury sitting wherever you are, to shut it down, go home, come back next morning, get it going, but not for the community. That's a life and death chain, and they don't work. We are able to upload, if you can't believe it, there are, let us say, at the very minimum, I have 22,000 construction workers to register. I have reached a magic number of 1,800. So you please calculate how many thousands I have. And we are able to upload 5 to 7 applications. Can you now calculate how much years or time I'll take to reach 22,000? And then this is only for 5 wards. There is another 192 wards with 22 into 22 into 22. So the technology has to answer that. If we don't change, if we don't spend our weekend helping people, if we don't make, public service, social service an integral part of our life, if we don't look at every animal, every being around us, and just put our windshield and, not even bother to open the door when the beggars are supplicating, I think we better improve. Because this is a warning to us. Emotionally deficient. And that's a serious crisis.
You talked about change, and I want to pick on that theme a bit, because that kind of will, wrap the discussion very nicely for us. Because the one thing that Hiral and I have gathered when we talk to leaders like yourself, Aquila, around the world, has been this concern with change with regard to social norms and behavior. For instance, this concept of wearing a mask, wearing gloves, not being able to shake hands or give people a friendly hug, not being able to go to a mall or a cinema theater or a theme park or even a public park to enjoy, the opportunity of being with society. Now, all of that obviously is a tremendous change that we think a post-COVID era is going to unleash on us. How do you see that from your perspective?
Okay, we see it very simple. Strangely, only one word or two terms, and that is expression of social solidarity. Day in and day out. They don't need you to shake hands. They don't need you to, eat in their homes or, whatever, none of that. What they need you to do is help them or enable them, not even help them, enable them and enable ourselves to lead a better life.
That's a pretty interesting point that you've made, isn't it, Sanjay?
Yes. And I think the opportunity for a post-COVID era to essentially change the way we can treat, maid servants, for example, is, I think, truly remarkable. I think we will start to see them as integral. I mean, for many families, I know of our friends in India who've been used to having a maid at home and now don't have one because of the lockdown, have realized what a value that maid can bring, right? Whether it's a part-time or a full-time. Don't you think, Hiral?
Absolutely. And, as Aquila mentioned as well, expression of social solidarity is something that will be looked at as well post-COVID. In fact, thank you, Aquila, for joining us on the show as well. And thank you, everyone, for tuning in. Sanjay and I will be back tomorrow, same time, to share more extraordinary leaders in these extraordinary times. See you soon.